She is a celebrity. She is well-known pioneer integrative medicine. She's a friend of Dr. Goldman, I think, and a lot of celebrities. I went to her website and I saw all the celebrities. She's kind of treating them, and so tell us, Dr. Dalal, about all those celebrities that you with them. Are they your friends, or are you treating them, or your patients? And tell us more about you. And we welcome you here, and we'd like to hear from you. And I believe you have a lot of innovative things that we want to learn from you.
Hello, everybody. I don't know if everybody can see me or not, and I don't know. Can you all see me? Yes?
Yes.
Perfect.
We see you. We see the thing. You're beautiful today.
Yes, you look lovely.
Thank you. Well, my name is, oh my goodness. I had this on mute. And all right. So my name is Dalal Akoury, and today I'm going to be presenting, I need to slideshow from the start. So really, there is a reason why I am who I am today. And, Dr. Patel, thank you. So today we're going to be talking really about mastering hormones and how important are those hormones when we come to cancer treatment. And I've been very intrigued for many years with the effect of stress on the entire body and how does that work. So how can I make the next one? It's not moving. All right. Why is it not moving? Why can I not go to here? So there is a hormonal synergy that is happening continuously in our body. There is a conversation, and the cross talk, and it's a real conversation. And it involves a lot of players. And one of them that we have not talked much about is really melatonin. And that plays a major role, along with progesterone and estrogen and all other hormones. But really the key is to tell you who I am. I am originally from Egypt. I came into medicine because my dad, whom I admired and loved very much, died from pancreatic cancer. At that time, I was 17 years old. I was hoping and dreaming to become an engineer like him. But because of him, I ended up becoming a doctor. And I made major, major sacrifices. One of them is I had to leave my country, Egypt, and I left my 2 children at home in Egypt with my husband, who was an anesthesiologist. So I left my oldest son when he was 2.5 years old, and my youngest was not even a year old. But I have worked so hard until I was able to prove myself. And we reunited, my children and myself and my husband, about 1.5 years later. Now I am the owner of a 7-figure clinic. And of course, the A4M had a major role in that development. But the reason was I did not feel comfortable with just a traditional medicine. I'm a pediatric oncologist by training. I spoke all over the world. I've written 10 books that are internationally recognized. And I am a pediatric oncologist by training. I trained at Emory, I trained at St. Jude Hospital, and I worked at the CDC on some polymerase chain reaction when it became something new. This is my dad, and I don't know if you can see me. I'm the taller girl in the far right. And my dreams came true. My turning point happened when my dad died from pancreatic cancer. And he was under a tremendous amount of stress because he was in a very high position in the government that led him to be under a tremendous amount of stress. And that made me believe that really stress has a lot to do with cancer. And that's why I analyzed, I understood all the causes, how it's all working together. and how it's really a symphony. And I studied the cancer map, and mostly in the US, it's a very prominent disease. And this is one of my patients, the before and after. This is when he had Kaposi's sarcoma and within a year, that's how he looked. And I have more and more pictures. I think Dr. Halasi, I've seen a lot of pictures of a lot of my cancer patients, the before and after, but I have a lot of also result in lab to show that is what I dream about, is to make what I have learned over the years become easy for people to understand. This is David, and I wanted him to have, a movie about him and what we did to get him to where he is right now. So for me, I always remembered, and I'm sure each and every one of you feel the very same way, that really stress is the fastest freeway to the cancer land. And we go from organization on the left side here to a chaos. And when we're in stress, we are in a chaotic stage. So how do we really dissect the stress disease, or what is stress? And most people in their mind, stress is, I have stress. What is stress? Stress is nothing but a response of our body to something. And that something could be through the outside world or the inside world. And it all has to do with the brain, and mostly the limbic system and the pineal gland. This is where everything happens. So we have to see that system. And when we talk about the HPA axis, we forget that we also have the autonomic nervous system, and they both work together on the same target tissues. And when we have, I'm not sure who mentioned that. I think Dr. Halasa mentioned that a little bit of stress is great, and even oxidative stress, it just begins the engine. Well, what can we do to keep that engine in a good stage? So that's really very, very important. So I wanted to define stressors, and most people think stressors are only things from the outside. So we have toxins that are stressors. We have sleep deprivation is a stressor. All the other things that most people know, but there is a whole basket of hormonal imbalances that is part of the stress response. So really, stress is just a body response to environmental factors, whether those are internal factors, whether I have pain because I injured my knee, or I had a stroke, or whatever. There's internal constipation or external factors. So that's really very important to understand what the stressor is. But when we come to the whole system, we will realize that the brain and the whole system is communicating. It's like antennas that are receivers, and antennas and receivers are sending information to that part of the brain that is the limbic system, and including the pineal gland. They're all continuously in communication, and it's very dynamic, and the hypothalamus gets a lot of information, and it sends that information either through the nervous system to the nerves, or electric, or through chemical reactions. And we all know that. I mean, I'm not sharing anything that every one of us don't know. So we have a sensory input, and that sensory input has those antennas, and those antennas exist in everywhere, whether it's on the cell membrane, and by the way, the membrane is the brain of the cell, of each cell. So that's why membrane is. So each cell has its own sensor, and that's why we have multiple antennas to feel and dissect. So when the hypothalamus receives information from the sensory input, it starts activating whether the thyroid hormone, the pituitary hormone, and the insulin, the ovaries, and the whole system. And then it has the output reactions. So this is key, and this is when we have the HPA, access is a great thing when we use it appropriately to the stress we had. Our genetic system is not equipped, has not evolved as fast as it should. We are still reacting to minor things the same way as we are leading away from a lion. So when we have too much height of cortisol, it really gets the clotho down. As you can see, they have an inverse relationship. When one goes up, the other one, when one goes up, the other one goes down. And there is a significant, no matter how high the cortisol is, if you have adequate clotho, like, and Dr. Halasa was trying to address that, it really restores. It restores all the dysregulation that is happening. So understanding that we're in a continuous conversation that is dynamic and changing. And that's why Dan's system is probably a great system, because it can just have a cross section at every moment. And what we do when we have a lab, it's just a cross section that really is expressing or describing what is happening now, not not 5 hours ago, not 2 minutes ago. Everything is so dynamic and is so changing much faster than we even imagine. Now, there is a difference between stress and chronic stress. And really, when we have cortisol, that's a great thing. But when we have chronic stress, that's when we have issues. That's when your epinephrine goes up. That's when norepinephrine goes up. That's when your prolactin goes up. And that's why your dopamine goes down. And that's when cancer develops. It is so important to really realize that the chronic stress makes proliferation more prominent, make more angiogenesis, make more immune invasion, make genomic instability happens even faster. With angiogenesis, as we know, that means more mets. With immune invasion, we know that creates metabolic dysfunction and disrupt the mitochondria, which is the most important element in the body. For me, I'm not sure, beside the brain and the limbic system and the melatonin, that mitochondria is mighty, is the mitochondria. It's really essential and important for some, yeah. So here is what happens. With the stress, with chronic stress, now, acute stress is great. It's like the Starling phenomena. It really makes things work beautifully. But when it becomes excessive and uncontrolled, then your stress hormones go up, which includes the glucocorticoids, and includes the epinephrine and the norepinephrine. And most of the time we ignore the norepinephrine and epinephrine. When we have very low cortisol, that's when our norepinephrine and epinephrine is extremely high. And that's when tumorigenesis happens. And that's when immunosuppression will happen. That's more angiogenesis will happen. And that creates that low-grade inflammation, that CRP that is higher than it needs to be, but not too high. And that's where we create a great microenvironment to promote tumor cells. And these tumor cells themselves will create more inflammation. So we get into a vicious circle. And remember, the more inflammation, the more neuroinflammation. If our neuroinflamed, we're creating more conversation with the hypothalamus that really creates disturbances. So it is so important to really pay attention to this and understand that the root cause of most of the problems and the chronic inflammation happens from the beginning of the stress. When we are stressed, we react, we create a chronic inflammation, and that chronic inflammation would lead to chronic stress, and the chronic stress lead to inflammation. So it's a vicious circle. And from then, we have higher level of catecholamines. So really, anytime we address adrenal fatigue, we always address adaptogens, we also address cortisol, we address the DHEA, we address the pregnenolone. We have not addressed enough progesterone, but we have totally ignored catecholamines, which are extremely powerful, and they are adding, they're fueling the system with heat. And all that will create the tumor and make things worse. I made a very, very complex system simpler because I love to simplify things. Because when I simplify to myself, I make it simple for everyone else and everyone understands. So even childhood trauma, even in utero stress, when a mom is stressed in utero, when we have childhood trauma, we still induce epigenetic changes that are transferred, not through genes, through the epigenome, to the child, to the newborn. And we are creating genetic alteration. We are creating change in chromatin remodeling and DNA methylation dysfunction. And that is all from chronic stress. Every single mom who will not helping her to calm down and embrace understanding what stress is and what the stressors are, and how can we restore the balance, and how can we work with homeostasis, and how we can get the allostatic load to be reasonable. We're gonna that's in my opinion. I'm a pediatrician, so by training, I don't do pediatrics. I do mostly integrative cancer care and chronic diseases. I've always done chronic diseases, but I did not know about Dr. Halassa until now. I've never been a hormone doctor. I've never been just an anti-aging doctor who just does hormone. I've always dealt with chronic people. And it's so important that we all join forces and we have a voice to really share the information to every mother, every father, explaining and helping them to achieve a state of homeostasis. And that starts with that next piece that I'm going to talk about, that mighty circadian rhythm. There is so much documentation in the literature that explains that how important that light is. That light is part of the stressors. Shift, that we have always talked about shift employees or shift per people, but we have not addressed how important it is, that light, that effect of that light is a stressor in itself. And we have an internal clock, and we need to be able to understand that. We need to understand how that tick-tock cortisol and how that changes, even that circadian rhythm changes the amount of hormones that are released. It changes, it's a dance. It's a beautiful dance that is shaping our future. And every single one of us is making a choice of what disease they're going to get or how healthy they're going to be. So the circadian rhythm and the HPA axis are really the key to every single disorder. You know, I know from Dr. Halassa that we think in redox. I always thought mitochondria. I always thought the stress, but really more important than all of it, in my mind and now, is how can we adjust our circadian rhythm? Because you will see the power of the circadian rhythm on even the HPA axis. How, if we have a healthier circadian rhythm, can we really affect, the HPA axis? How can we really affect the whole system, the pituitary gland, the adrenal gland, and all that? And we need to understand there's some proteins that are part of that master clock system. And as sad as it may sound, the disturbance of that circadian rhythm which cortisol leads to circadian rhythm disturbances. That in itself, with the sleep disturbances, with the fatigue and the cognitive impairment that is happening, causes a tremendous amount of inflammation, leading to endocrine dysfunction at the HPE axis and the cortisol. But remember that hypothalamic axis is not just the hypothalamic pituitary and adrenals. That's hypothalamic pituitary and gonads, hypothalamic pituitary and thyroid. It's all working together. And if one system is overloaded, the other systems are completely neglected. So we need to really focus on how can we restore a circadian rhythm, whether using the proper lighting, whether how to induce the melatonin production, how to do intranasal melatonin with cyclodextrin or not cyclodextrin, but we need to make sure that we address that, because cortisol and cancer can be a deadly dance if we have a disrupted circadian rhythm. It is a fact. And look at it, it's everywhere. And we should be the ones. I've done cancer treatment for many, many years. I'm a pediatric oncologist by training. I have also treated a lot of cancer patients in an integrative way. I did the program with Dr. Mark Rosenberg with the A4M. I did the Best Answer for Cancer. I did work with Robert Rowan. I worked with homeopathy. There is nothing that I did not try to understand and learn so I can become one of the best in treating what my dad died from. I never wanted any more children to suffer. I mean, back then I was a teenager. Compared to now, I probably was a child, teenager who lost her dad, who was her main person that I wanted to be like. I lost him to cancer, and I wanted to find answers to cancer. So here's what happened if you have a disrupted circadian rhythm. You can see it. We have to restore that awake and sleep dance again. We have to make sure, because it affects everything. It affects all the hormones. It affects everything from the ovaries to the pancreas to the hypothalamus and the hippocampus, memory loss, cognitive dysfunction, everything, cardiovascular, and what I focus on the most right now is tumorigenesis. So it's very important to me to address that. Now, one thing that I wanted to discuss first before I move further is when we talk about P53, it has an effect on those two proteins that are affecting the circadian rhythm. And that's the clock protein and the BMAL1 protein. The P53 inhibits the clock protein. And if it inhibits the clock protein, it keeps the BMAL protein, BMAL1 protein up. And that's what melatonin does. It helps to using these peptides in order to repair the DNA. So it's really important for us to understand the power of P53. The next slide will show you that the P53 is stimulated by melatonin. So melatonin really inhibits genomic instability. It stops that proliferation signaling that is continuous. It stops the replication of immortality. It inhibits the metabolic dysregulation. It enhances apoptosis. It enhances anti-aging, and it stops tumor promotion. It stops angiogenesis. It stops metastasis, and inhibits the invasion of the immune system. So really, how can we restore that nighttime warrior? So here's how many genes and how many things are under the influence of melatonin. So it inhibits the angiogenesis to decrease VEGF. As you can see, the slide is very self-explanatory. I can tell you about each and every one of those, but it's all self-explanatory. It stops these processes. It stops many, many things. So it is the master key that can unlock genetic control. Cancer and every disease, chronic diseases, are diseases of the brain. They are diseases of limbic system and pineal gland. The dance between the limbic system and the pineal gland has to be restored. So there is a magic between the sun and the moon, and we need to understand sun means energy. Sun means the fight. Sun means the stress. And the moon is that yin and yang. That moon is the calmness. That moon is the time we restore. That moon is the time where we have harmony. And we have the hormones are only released based on that cycle. So the circadian rhythm affects everything. It affects every hormone. Even if we give hormones out of cycle, out of the circadian rhythm, they're not the same effectiveness. They're not affecting the epigenetic message, or the mRNA message that they are producing is completely different than if that was a message that is coming at the right time, at the right clock. So we need to understand that clock is key to healing. And as I mentioned earlier, melatonin not only induces apoptosis, but it also inhibits the mTOR. And that in itself is key to cancer health. Now, I don't use only that to treat my cancer patient, but that's one of the key things is restoring spirit and mind and the body. And I don't ever say body, mind, and spirit, because really the spirit is the key. The mind is the next, and the body is really the follower. The body listens to what the spirit and mind interaction happens, and the choices of stressors, and how do we react to stressors. So we need to remember that melatonin is magic, and it can be a new hope for cancer. And there's a lot of other methodologies that I use, and I've done many, many, many things. And I'm very grateful to say that I've helped a lot of patients, and I can discuss that at some other point. Now, we can't forget that melatonin also induces something that is very important that we are all interested in. And I was the first one who discussed NAD+ at the American Academy of Anti-Aging Medicine when I started with the first integrative addiction certificate that I've introduced to Dr. Pam Smith. And I'm the first. I had a beautiful talk about how NAD is produced and how can we produce it and what it really actually does. So I have that. But melatonin induces the sertraline, and that in itself blocks that clock. And by blocking that clock, it helps BMAL1 to stimulate the NAMPT, and that's how NMN is produced, and that's how we're getting NAD+. So really, this is all working together beautifully. Oh, I can't move the slides. What is it? Maybe this way. Okay. So we all talk about the tumor microenvironment, and you will not believe that melatonin affects each and every one of those tumor microenvironment. It's really a secret weapon. It stops the proliferation. It works on, stopping the angiogenesis, carcinogenesis. You can see that even vessel formations through different genes, and we can go through each and every one of those. Now, we talked about oxytocin today, and I didn't realize you're going to be talking about oxytocin. Now, oxytocin in itself works in that paradigm in a very beautiful way. It has an elegant way to be part of this, to calm things down, to help restore the whole system, because it's part of that brain mechanism that we're dealing with. So what is the limbic system? That limbic system and the hypothalamus and the pineal gland and the amygdala, they're all powerhouses. And they are commanding every single thing in the body, not just the hormones, because the cortisol, the hormones, and everything is dancing together. If we pay attention, like even if we dopamine, even the amino acid that are used for making thyroid is the same tyrosine that is used for dopamine. It's also used for norepinephrine and epinephrine. So if we are under a tremendous amount of stress, we are depleting our thyroid completely, because we are shifting and producing more epinephrine and norepinephrine. So that steal, we don't talk about it. The tyrosine steal, we never discuss, but it's part of the whole thing. So we're talking about cortisol steal, we're talking about progesterone steal, we talk about all that, but we have ignored that everything is in harmony and they're talking together. They are creating powerhouses. And I'm going to try to be as quick as I can, but I'll do my very best. So what is the hypothalamic? What is the HPG axis? Because that is a power. We're talking about sex hormones in relation to health. So if we are activating the HP hormone, the HPA axis, we're going to unstimulate the HPG axis. So what if we have a certain amount of energy, the mitochondria and the ATP we have is a certain amount. So we have to budget that. If we're draining everything to that through the hypothalamus to the other system, we are stopping the gonadal system. So that is something that we need to be aware of, that if the HPA axis is stimulated, the HPG axis is not stimulated. It's actually completely inhibited. So that creates chaos. That creates inflammation. That creates the inflammatory cascade we're talking about and all those cytokines. And that's why, people who, whether they had the vaccine or didn't have the vaccine, some people reacted differently. I have not. I refused to be vaccinated, so I wasn't. But and I didn't get COVID, and many people who were did. But I work very much. We are under stress. I'm under a lot of stress. I'm a doctor. I'm a person in the medical field. We are under stress, but I taught myself to be able to breathe. Taught myself to take that quick moment to get to that alpha wave, no matter where I am. I could be under the most, if doesn't matter how chaotic my life is, because I'm not going to lie to you. My 70 years of being in the US have not been just rosy. I had a lot of times where things did not, more times were hard times, but I'm still 70 years old and looking the way I look.
Mhm.
I created this PowerPoint myself. I didn't have anybody to create it. I worked, and that tells you that I've learned to get into that alpha mode by getting to breathing. I taught myself breathing exercises ever since I was a child. And that really helps me. 5 minutes of that restores that system again. So everything we do, if we have light contamination continuously, you turn on and everything is contaminated. So it's so important to really see how we can restore that balance again. And as you can see, when we look at our system was from the hypothalamus and to the activation of the either ACTH cortisol system or the gonadotrophin system or the thyroid system, we have a balance. I hear something really. So where do we start? How did we get here? Well, we cannot forget that we started from cholesterol. And the cholesterol is the father of every single thing that we're talking about, from the cortisol to all the glucocorticoid, the steroid hormones. So cholesterol, really, one of the very first thing would be, a whole cascade. But we come to pregnenolone, and the pregnenolone really helps us become progesterone. So progesterone is the one, if maybe pregnenolone is the grandmother, and progesterone is the mother of all hormones, sex hormones, including cortisol. And that's why when Dr. Halasad keeps talking about progesterone, I've written a book about progesterone, and I didn't really know, and I'm trying to present something at the A4M about progesterone. So progesterone is the mother of all the hormones. And one of the things that is really very important that I will show you, if we're not making testosterone, we're going to make more estrogen. Okay, so that I want you to remember here, because we make more estradiol if testosterone is aromatized. But estrogen is made mostly from progesterone, that when we don't have testosterone, when androstenedione does not convert to testosterone, it converts to estrogen. So if we have no testosterone, we are creating estrogen. And that's a disaster to have that much estrogen, whether for men or for women. And we just look at the HPG for men and female, and the same hormones, same downstream, upstream, you have the same thing, LH and FSH, anterior pituitary gland, everything is the same. Well, when it comes to the target organ, the ovaries are going to produce the estrogen, the progesterone, and the testes, we're going to do the testosterone. I'm going to just recap here and see how cortisol theft robs us from the progesterone sex hormone pathways. So if we have progesterone, if we have a lot of stress, we're going through this here. So every pregnenolone goes into progesterone and goes in here all the way to cortisol production. Go back. When we go to cortisol production, then from the progesterone, you go to the pregnenolone, the hydropregnenolone, and come back to that one. Androstenedione again, and either it does testosterone or it goes to estrogen formation. So estrogen is byproduct of not having testosterone produced. The same story here. I think I made it clear more than once that progesterone is the reason why we are having thing. Now, when it comes to estrogen, now we're going to shift gears. We talked about the HPA axis. Now we're going to talk about the two most important female, we call them female sex hormones, but they're really sex hormones for all of us, for men and women. And what is I'm describing here is talking about what estradiol does versus what progesterone does. Estradiol creates cells, is proliferation. It fills up the cells. Now, the progesterone take all these cells and now start making walls. It start creating structure. It start creating differentiation. If we don't differentiate, we don't die. If we don't commit to a lineage, we don't die. So immortality happens from the fact that we're not committing to a lineage. So once a stem cell commits to any lineage, that's when apoptosis becomes a possibility. That's where autophagia becomes a possibility. But if we don't have commitment to a lineage, that does not happen. Again, here, if you would see, estrogen affects gene expressions at the deep nuclear level. It has receptors, and sometimes we need to understand the difference between all the estrogens, whether they're xenoestrogen or soy-based estrogen that are weaker estrogens, and how do they affect the estrogen receptors, because there is a different signal that happens from the estrogens depending on what kind of estrogen it is. All right. And here again, not only that we should worry about estrogen, but we need to worry about the detoxification of estrogen. And that is when we are able to transform estrogens to, methylated estrogens. And that's key. If we are not able to do that, we have methylation defects, we are going to be having a problem with all our estrogens. So we need to check everybody's methylation defect. So again, estrogen can go into estrone, it can cause proliferation, it can cause DNA damage, and that's mostly the estrogens, as we all know. So what does progesterone does? It activates the MPK pathway, and that halts cancer, and it restores metabolic balance. So once you activate the AMPK pathway, that leads to inhibition of the growth and inhibition of proliferation. It also helps to regulate the metabolic function. So having progesterone help to restore the metabolic function, mostly in disrupted cancer cells. Progesterone helps starving the tumor from the VEGF, because I'll show you that it inhibits VEGF. So progesterone is capable to inhibit VEGF. So that, hence, it stops angiogenesis. Hence, it stops METs. So that anti-angiogenic effect happens from the starvation that is happening, because you stop by when you don't innervate it, you don't have the blood vessels available, so you are compromising nutrition and oxygen to those cells. So what does progesterone do? It promotes apoptosis. It influences, inhibits cell growth. It reduces inflammation, and it modulates immune response. It does that through stimulating production of P53, or helping P53, inhibiting mTOR, inhibiting NF-κB, TNF-alpha, and VEGF. So, and all the inflammatory pathways. So that's why progesterone is very important. Now, estrogen is important, but estrogen overload is the problem. So that estrogenic overload produces an epigenetic change. And it's so crucial for regulating gene expression. So it can modulate the DNA if we have good methylation, so we're feeling better. So we need to check our methylation pathways. We need to know if we have issues with methylation. in order for us to know if we really have excess. Of course, we're talking about xenoestrogen. Of course, we're talking about the fat and aromatization. But are we methylating properly? It's very important. It's very, very, very important. So estrogen dominance will increase cell proliferation, cell growth, and it will inhibit apoptosis. So that's very important to remember. And we talked about methylation again. And here we're going to look at what estrogen does to the genes versus progesterone. The top part shows the proliferation. So we're promoting making more cells. And the genes that are influenced by progesterone are the genes that promotes differentiation at all levels. Now, here is another major fuel. That's the dark side of weight. It's not, I look overweight, I don't look good, I don't look pretty. No, it's that fat is not inert. That fat is producing increasing androgens, the wrong androgens, increasing the estrogens, the wrong estrogens, which is the estrogens, and activating creating the methylation defect and genetic DNA transfer defects. So what are the risks that we have if we're overweight? Why do people develop breast cancer if they're overweight? Because that increase the insulin level, hyperinsulinemia. We do genetic modification, and we're creating a hormonal imbalance. We're creating inflammatory cytokines and adipokines that can lead to chaos and genetic changes. And as we talked again before, earlier, if we are having more androstenedione, we have estrogen. So if we're bypassing creating more testosterone, we're going to create estrogens. Estrogens is the problem. So testosterone, when it's aromatized to estradiol, we don't have as much problem, but we are having problem if we are not able to convert to testosterone. So I think we've explained before what happens when we are obese. We have insulin issues, we have inflammation in cytokines, we have elevation of leptin, IL-6, TNF-alpha, and we have a problem with insulin resistance and metabolic syndrome, and all that at the end activates the downstream signals. And it can cause the mTOR pathway would be activated, and we develop breast cancer or other cancer, prostate cancer, and so forth. Now, we know that if we don't do anything, we're going to continue to have that crazy, and I hate to say crazy, healthcare system where a patient is seen in 5 minutes and given one prescription, and you have no clue what's happening. It's almost like an assembly line medicine. And I was an ER doctor at some point, and I did that for over 25 years while I was training in anti-aging and functional medicine and integrative cancer. And I've seen many, many, not only diagnostic errors, but even treatment errors and iatrogenic errors. And patients deserve better. We deserve better. We deserve to be able to live a life that we dream to live. And that's been my dream. And that's why I've been working so hard to create a program to help people understand that everybody's problem can be our opportunity to help and our opportunity to shine. And actually, I created this, as you can see, in 2017. So that particular slide. And so we have a problem. Every problem is an opportunity for us in disguise. How can we take that opportunity? How can we take this problem and think it's a gift? And how can we take this gift and take that gift to the next level where we all can have fun and help? What's wrong with us having and own a 7-figure cash only clinic? It's very hard for people to understand to do cash clinic. It's very difficult because it was a very hard thing for me to say, oh, I'm only going to say cash. And the more you say it, the better it gets. The more you are convincing your patient. It's just also you have to train your staff. We have to train our staff so that they understand it's a crime if we don't help these patients. And we cannot, I wanted to help everybody free because my dad died from pancreatic cancer. But then if I bankrupt, I can't help anybody. So really, we have to put the mask on in order for us to help others. So we need to think of our well-being. We need to get to restore that emotional thing. I wanted to create a program called Heal the Healer. We needed to heal from the inside out in order for us to heal others. So it's really important to also accept the fact that it's nothing wrong to have a 7-figure clinic. And the component of it will be all these medical training of the chronic diseases, but not only that, but also addressing the cancer, the chronic diseases, and the anti-aging. And I believe that neuroinflammation and neurodegeneration is the key to all the other diseases. I should have started neuroinflammation on this side because it goes that way. It goes from neuroinflammation down. That's the key to restoring health. So what else we need? If we are all here, 36 people listening to what I said and we all are saying, we're not touching anybody. We need to have a brand. We need to have to know the right branding, how to really attract the right brand. Like today, I could have dressed up like everything. No, I am presenting. I dressed up as a doctor. I dressed up with the colors that makes me a brand. I'm 70, but I am a brand of youth. I'm a 70-year-old person who's cognitively working at the level of 50-year-old person. Whether I have the system or not, clinically, I am able to cognitively talk that way. But if you have the right brand, then you have the right marketing. How are you marketing? How do we market? Who's the target audience that we have? All that is part of what I teach and want to train people to do properly. Then selling, how to sell without selling. I don't like to be sold anything. And if I don't like to be sold, nobody wants to be sold.
Is this still a CME lecture?
Yes, but you don't have to discuss that part. We can finish this, and this is where we end.
Okay. Yeah, we can close the recording and then Shell will edit it. And then we can talk about the business side.
No, we don't have to talk business side, but I wanted to help